Our bodies are our instrument to experience this life and everything that God has created in this world, and to love and to play and to laugh. And so that's really our family's, that's deeply rooted in our family ethos, right? Is like our bodies are instruments for living the life that we're meant to be lived and why God put us on this earth. And so to not overemphasize the way that one looks, right? We have a responsibility to care for ourselves and to treat our bodies with respect and health. And that's like the frequency kind of underlying any conversation.
Aloha, everyone. Welcome to All Things Possible.
Glad to be here.
Yeah, I'm looking in our screen. I'm looking pretty tan here.
Yeah, and you've been in the water quite a bit lately. I feel like your surf tank is pretty full, yeah?
Yes. Kinda, yeah, it's pretty full. It's like medium full.
It's still unsatisfied.
It's pretty hard to get to the full satisfaction, honestly, especially now being a mom. Like, priorities are a little shifted, and
your surf tank is rather large. It takes hours and hours of surfing to fill that thing up.
This week, I've been testing some new boards. I've been riding JS Industry surfboards from Australia. So I got 4 boards in the mail.
How did they feel, by the way?
I mean, should I say it? I mean,
they're
actually a little stiff.
Okay, I'm learning.
Did you see at Flags?
I saw you... Edit that out. Edit that word out.
Nah, it's okay. It'll be fine.
It's okay. Yeah, I did see you on 2 turns. I was like, she looks a little stiff on that board.
Yeah, this batch is just coming out a little different.
Well enough
I don't know
already.
What's going on. I already messaged my shaper because my last batch was so good. I was just like, this feels like butter underneath my feet. And this batch has felt a little stiff, but they are really pretty because I did the spray jobs.
You think they're better for barrel riding?
I actually feel like, one of them could be a good kind of like mid-size waves where it's kind of barreling down the line, pumping.
Sick.
But yeah, I'm stoked. I got a little tan going. A few episodes back, I was looking a little roasted sunburnt, and then I was talking about seed oils, and people were lipping in the comment factory.
Not that you
online. I was like, oh shoot, I'm like looking sunburnt here, and they're lipping.
Are you serious? Because seed oils make you more liable to be burnt.
And then I was like claiming how I don't get as sunburnt, which is true, but I'm just saying, like, still that midday sun window, like no matter who you are, you might get. I mean, I've seen like people like Dave Asprey claiming he doesn't get sunburnt at all, but
part Viking, you have that more paler skin.
Yeah, I'm more prone to it versus like if you go in the sun, you're instantly tanner, but
yeah.
Well, anyway, today's conversation.
Let's jump into this conversation that we have today.
Yeah, so today's conversation, there is more than meets the eye when it comes to eating disorders. And I've been intrigued on this topic and subject and felt like I've needed support so that I could support people around me more who might be struggling with this. So today we have a special guest coming on to talk. She specializes in clinical psychology around
also working in the hospitalization unit for people with
very severe anorexia to the point where their heart is having, it's slowing down, their brain is getting smaller. So it is a really kind of serious challenge disease, so to say. And this conversation was really insightful. I think it's just really important to kind of be aware of how to approach people. There's, again, more than meets the eye. And so we hope you enjoy this conversation with Deena Muno, where we'll kind of discover what's beyond meeting the eye, so to say. Well, aloha, Deena. Welcome. I'm so excited for today's conversation. It feels kind of close to home because of what I grew up around, and I'm very passionate about health. So if y'all are tuning in today, for today's subject in particular, be sure to check out our other health episodes so that you can kind of have a well-rounded approach to holistic health and getting healthier across the board. But Deena, introduce yourself, share with our audience the type of work you do and how you got into that and what it's been like.
Yes, so my name is Dr. Deena Muno. I am a clinical psychologist. I work at a hospital we have an inpatient unit that specializes in the medical stabilization of eating disorders. So I have a specialty in working with folks who are struggling with disordered eating or eating disorders. I also have a private practice where I work with people with eating disorders as well, but also, struggling with anything or wanting to improve in their life and across kind of the board. So have more of a general private practice and then a specialized practice at the hospital for eating disorders.
What brought you into that field of work? Like, what gave you that passion to jump into this?
It's interesting. So my husband actually works in agriculture and food. He's a grass-fed beef rancher. And so he's on the production side of food. And I, with my background in psychology, have always been interested in eating disorders and substance abuse, family systems. But we're kind of like, we have these very holistic conversations about food and family and the impact of food on family and our overall functioning. So I think it was a kind of a natural extension of what I'm interested in as a person and health and holistic health in general. But I went into grad school being interested in working with people with eating disorders and or substance use and with children and adolescents.
Yeah, my first exposure was like growing up, I had a few friends that had eating disorders, and being so close to them, it was kind of hard to, like, you knew there was something going on, but it was kind of hard to pinpoint. And then fast forward into my early adult, late teens, I remember like meeting several young girls who were like, I read Soul Surfer while they were in the hospital struggling with almost dying from eating disorder. And it just like impacted me and stood out to me so much. I'm like, whoa, my story reaches like such unique cases that, I never would have thought. But like, how does, in the patients that you've worked with, like, how does one get to that point of like, they're in the hospitals kind of fighting for their life? And I don't know, can you paint the picture of what that looks like and where that person is at and the destruction that's kind of brought them to that place?
That's a great question and a very big question, and one that I could talk about for days probably.
Yeah.
So I'll do my best to do a summarized version. But there's a lot of layers. Eating disorders are extremely complex because it's kind of the crossing of, like I said, like family systems. There's certainly family systems, and people often want to know like what causes an eating disorder, and it's so multifaceted. So there's, there can be trauma, there can be family systems or things going on, but there is certainly a neurobiological component to eating disorders, and especially severe eating disorders, that has to be part of the conversation. So there are actual differences, measurable differences in kind of the brain wiring of people that end up with really severe eating disorders. The types of eating disorders that I see in the hospital when people are actually hospitalized for an eating disorder for medical stabilization are almost always either anorexia, so restrictive eating disorder, or another disorder that's most people haven't heard of called ARFID. So that's avoidant restrictive food intake disorder. I'll say it again, avoidant restrictive food intake disorder. So both of those are restrictive disorders. And the reason that we actually see people in the hospital is due to the medical complications of food restriction. So we see like physiological compromises, and people would often meet criteria to be hospitalized because their heart is starting to slow down. To conserve energy, the heart is actually slowing down. So we admit people for bradycardia, electrolyte abnormalities. Those are the main reasons that people would be admitted. So we don't see as much bulimia or purging because typically those can be fixed like in the emergency room with a bolus IV, like just rebalancing electrolytes. So usually people are in the hospital because they have the medical complications, the medical cost of not eating enough and the impact on their heart specifically.
Wow. And then is there any other kind of organ issues that kind of come alongside of that?
Yes, so many. So
Can you kind of paint the picture of like how bad is it really? Like, I know your focus is more on maybe the psychoanalysis and like the mental side of things, but I always think like, it's all intertwined, but like I know you know a bit about nutrition too. So I was just like my nerdy health side goes into like, well, what else is going on in the body and how destructive is it?
Every system is impacted by malnutrition and restriction. So we really focus on the impact to the heart and to the brain. So I wish I could show you my screen. We have some very impactful MRI studies where we've taken photos of people's brains when they're restricting and then people who haven't restricted. So one that I often reference is an 11-year-old boy with anorexia. And then an 11-year-old boy with no eating disorder. And you can see actual brain matter loss. So white matter and brain matter with brain starvation. And the body doesn't like empty space. So the body fills those pockets of the brain with cerebral spinal fluid. And having that extra pressure and having those brain changes, having the loss of brain matter actually impacts one's ability to think and process, and then impacts every single organ and every single system in the body. So we see compromises to cardiac function. We see the slower heart rate due to conserving energy and actually loss of cardiac muscle. We see changes to the digestive system. People forget that with dramatic weight loss, you don't get to pick and choose where you lose weight, right? So you lose muscle mass everywhere, including your GI system, which is smooth muscle.
Oh,
So you lose motility, and you lose like efficiency in your GI system. So often when people have been restricting and try to eat again, it's extremely uncomfortable. That is the number one complaint we get in the hospital because they have really slow motility. We see changes in the like hormonal system. So looks like a loss of a period for a young woman.
Right.
The really scary thing with that is in order to stop one's menstrual cycle, the body stops producing estrogen, and estrogen is the key component for for women to lay down new dense bone. So we actually see bone density loss. So we've had patients in their late teens and 20s who have been struggling with an eating disorder for a number of years, and we'll do scans of their bones, and they'll have the bones of like an 80 or 90-year-old and be at high risk for fracture, actually have osteoporosis as a teen or young adult. Kidney function, the whole metabolic system gets out of whack. I mean, it is through and through wreaks havoc on the body.
Your job is like so laser focused on this. Like, do you see, are you slammed with patients? Is this like a widespread kind of epidemic, so to say? And also, I'm like, it seems like it would be super prevalent. I mean, we've talked about before about just the effects alone of social media and people comparing themselves and like this ideal physique that you need to attain, and like can cause just identity issues. It seems it can cause a lot of just discontentedness, and I can see how that could affect a lot of folks. And is there also, so one, is there a lot of folk like battling this, and then what age range are you seeing predominantly in there?
Yes, it's extremely prevalent. And you bring up a huge point, which is social media has really sadly changed this landscape and made it much worse. I think the most recent statistic is about 22% of people struggle with disordered eating. I would say it's probably higher than that. And about 9 to 10% of people will have an eating disorder at some point in their life. So it's not as prevalent as maybe you would think in terms of the
That's
statistics
still
that we're
really
seeing.
high, though.
Yeah.
Yeah. About 1% at any given point in time, about 1% of the population in the United States has an eating disorder. So it's prevalent, but it's not like half, right? It's not 50%, 60%. And then the people that end up in the hospital that are hospitalized for an eating disorder is even less. I think it's like 1% of the 1%, right? It's even less. So it is a big problem, but the really severe cases, aren't super common.
Yeah, like
And then
one
also,
thing is like body dysmorphia, like people just have struggling with, the mental health condition where a person becomes fixated on perceived flaws in their appearance, often focusing on one specific feature like skin, hair, muscle size, and then how that can often contribute to like then go into an eating disorder.
Yes.
I feel like, it's not just like young girls, like you mentioned, a young boy, even older grown women struggling with this. Like it seems like it's, I know a few people with this, but
This might be a good point for me to go on a little bit of a tangent, but help bring me back around.
yeah, that's fine.
Because a really important part of this conversation is like the neurobiology of eating disorders. So typically, people, especially with restrictive eating disorders, I will say that so I'm going to talk about restrictive eating disorders, and the neurobiology there. And there are neurobiological differences in people with like a binging purging or a purging presentation or a binge eating presentation, but it's different than what I'm going to talk about.
can you break down neurobiology? What do you mean?
Yes.
What do you mean?
So
by that?
neurobiology, I mean, there are like visual differences if we were to look at a picture of one's brain, and like measurable differences in the way how the neurocircuitry. So like, for example, somebody with anorexia is given a piece of chocolate cake. Their brain reacts and different parts of their brain light up. The parts that typically would light up if there was a tiger in front of them, right? Fear, anxiety, light up when presented with chocolate cake. Whereas, a typical person when presented with chocolate cake and we're looking at their brain on an MRI, it's excitement, it's dopamine, it's all the pleasurable circuitry that gets fired off. So there's actual wiring differences in the brains of people with anorexia versus the typical population. So that's a really big part of this. So the neurobiology, usually when I sit down and I talk to families when they're admitted to the hospital, and I ask parents about their children. Tell me about your child. Tell me about what were they like when they were little. Tell me about their personality. And almost across the board, I hear since as early as I can, pinpoint personality emerging, they have been conscientious, they have been kind, they have been a good friend, they have been observant of other people and their emotions, they have been a rule follower, they've been sensitive to punishment, they have been detail-oriented, they have been, if they have a goal and they set their mind to something, get out of the way because they're going to achieve it. So there's kind of this like personality trait set that we see associated with anorexia. Now, if you can imagine, go down the road, puberty hits, there's changes that happen in the brain. And then we have the cultural factor of, I want to look a certain way. If that trait set gets set on, I want to lose weight or I want to eat the perfect diet, it can be deadly, right? Like the high attention to detail, the goal-oriented nature, the sensitivity to punishment, right? Something doesn't feel good, it's like registers like 100% in their brain and body, whereas the average person, it might not be as uncomfortable of a sensation. So if you take that trait set and you put it on the goal of losing weight or having the perfect body, it can get out of hand really fast. The other issue is that it ends up being a cycle that can be really hard to get out of, because as you restrict, as you don't meet your body's nutrition needs, the brain starves, the brain changes, and the brain actually becomes more rigid. So we see the rules get even more rigid. We see the goal move to be weighing even less or looking even more thin. We see more and more rigidity and more restrictiveness in the capacity of the brain as one restricts their nutrition intake. So it ends up being this cycle that is deadly and can, be so hard to get out of.
Yeah.
Until very recently, anorexia was always said to be the highest mortality rate of any mental illness. Recently, that with the opiate epidemic, that's shifted to substance abuse. But yes, it's extremely deadly because this cycle gets started and it's really, really hard to get out.
Yeah, is the way to get out like by, obviously you would need some kind of like therapy or help, someone like you to kind of come in and help unpack those neural pathways and kind of reframe like how you think about things and like how you view. I imagine it takes a lot of work to kind of readjust those neural pathways, right? Like,
yes, it's a lot of work because people are born this way with this trait set and this neurobiological wiring. Like, it's not necessarily something that can be changed or like that we want to change, right? That like their personality and the way that they are. And so it's kind of like you're trying to rework and rebuild new neural pathways, redistribute their strengths across their life, as opposed to being laser focused on body image or losing weight. But it's really hard. It takes a lot of time. It's a combination of refeeding and renourishing the body, giving the brain what it needs to heal, right? Trusting that the body knows how to heal itself, and then doing the more psychological work of like challenging thoughts and getting into where these ideas and beliefs come from. Like, I'm always asking, like, why does it matter if you look different? Why does it matter if you lost weight? Why does it matter if your body looked a certain way? Really, at the end of the day, to kind of get into the why. And that's often where we see, a lot of social media reinforcement coming in and all of that somebody should look a certain way. But this is also why you continue to see disordered eating or eating disorders across the lifespan, right? Like, women continue to struggle. The recovery rates are not great because, a lot of times people will recover and meet subclinical levels of disordered eating, but not be fully recovered and not have full, food freedom or full confidence in their body.
I've spent my whole life in the ocean, and I've learned, just like wearing a seatbelt or a helmet, safety matters. That's why my family and I use shark bands.
Shark Bands uses patented magnetic technology to deter sharks by disrupting their electroreception. Kind of like a bright light in their eyes that says, nope, not today, shark face. No batteries, no charging, just simple, effective peace of mind.
Whether we're surfing, swimming, or just splashing around, Shark Bands is our go-to for ocean safety.
You want to geek out on how it works? Dive into episode 14 for a deeper look at the tech.
And check the show notes for the link to Shark Bands, because your peace of mind in the ocean is worth it. Stay safe, stay stoked, and keep loving the ocean.
Have you seen any of anorexia or any like restrictive eating disorders under the guise of like intermittent fasting, or like under that fasting, like saying this is like good
fasting.
For me? It's like kind of that trend right now.
Yeah.
It's been going on. Have you seen that?
Yes. And oftentimes that can be a trigger to an eating disorder. So if two people do intermittent fasting or any kind of diet, and one person has that neurobiology and the other doesn't, right? Like, just the act of dieting, restricting, fasting, even if it's in the quest of health, can really start that spiral and get out of control, ultimately lead to these brain kind of more rigidity and get somebody stuck in an eating disorder. There is a study that was done in the 1950s called the Minnesota Starvation Study. We reference it all the time at the hospital, but quick summary, they took a bunch of young men without any history of eating disorders, took half of the group, cut their calories in half, and watched to see what happened. And some of them, so they all developed eating disorder behaviors. And then with refeeding, about 60% of them, 60% of them, well, really 30% of them got better. About 30% of them had some eating issues after, and 30% of them really, really struggled with eating disorder, all the ongoing follow-ups, because they had this pre-existing neurobiology, then they dieted, caused these changes in the brain, changes in the body, and they just couldn't get out. So one of the things that can end up leading somebody to have an eating disorder is dieting or trying to, follow the intention is health, right? Oftentimes the intention is to get healthy or do something to help themselves, and then ultimately it just gets out of hand.
That's wild. And that study you said, the Minnesota study, that was all men, right? Because when I think of eating disorders, I think of women more than men. But are you seeing it in men a lot as well?
Yeah, the rates vary between 10 to 25% of eating disorders are in males. So
it is mostly
reflected
women, but some men struggle too.
We have a lot of parents probably listening to this podcast, and maybe what are some ways that like parents can be mindful of, like, or they concerned about their daughter or their child having an eating disorder? Like what are some action steps that a parent could do to kind of come alongside, or even just to identify, like, oh, I wonder if my daughter has a disorder, and what could they do?
This, yeah. Or a friend too. Like, I'm like,
yeah,
I want to support my friends, but I don't know really how to.
First and foremost, parents, I think there's a lot of blame and like a lot of guilt that parents often have if they're worried about their children. And so, we don't want that to be a barrier to asking questions, and to kind of, sometimes, you don't want anything to be wrong with your child, right? So sometimes we kind of turn the other way and don't look. And so certainly I'd recommend, if you're worried, asking them, starting the conversation. We know that early intervention is key. After a certain point of time in an eating disorder, it's the rates of recovery are almost zero. So you want to get help as soon as possible. I think within the culture of the family, the more that you, have positive conversations about bodies, and especially for moms, we forget that we really lay the original template for our daughters' views of their own body and beauty. And so the way that we talk about ourselves, the way that we look at ourselves in the mirror, the way that we, how we value beauty, how we live that out is so essential, because that really is internalized by our daughters. So it's not to blame moms, but to kind of call, some accountability and call some action, and so that you feel like you are able to do something. Because at some point it ends up being social media and friends, and that is the loudest voice that our daughters hear. But for a long time, it's us, and we lay that early foundation, that early template. So
can you paint a picture of a conversation you might have with your daughter as you're like getting ready for church or going out to dinner or out in nature, wherever it may be? Like, because how old's your daughter?
She's a year and a half. Well, my son Max is,
but your
3.5.
older. Okay, so do you premeditate any combos you might have with your daughter?
Even now, right? We talk about like how strong she is, and how beautiful she is, and how smart she is, and we just balance, right? Not an overemphasis on image or any one body part, but just positive. I really, our bodies are our instrument to experience this life and everything that God has created in this world, and, to love and to play and to laugh. And so that's really our family's, like, that's deeply rooted in our family ethos, right? Is like our bodies are instruments for living the life that we're meant to be lived, and why God put us on this earth. And so to not overemphasize the way that one looks, right? We have a responsibility to care for ourselves and to treat our bodies with respect and health. And that really is at the core of like, that's like the frequency kind of underlying any conversation.
I know, just thinking about our daughter Alea, I'm like, I would burden if she somehow ended up in some sort of disordered eating, I would burden it 100%. Like I would just be so frustrated on myself.
Yeah,
like
right.
I feel like I take ownership of our family's health very much so. And so I could see myself really struggling with that. Not that it's about me at the end of the day. At the end of the day, it's about her and like her well-being. But yeah, I just feel like that would be so hard. And yeah, I don't know. Like, I just, the last thing on earth I would want is for her to, you know, starve herself or keep herself from the nourishment that she needs to thrive.
Yeah.
So,
No, I was thinking too, like it's so important, to have that positivity, and faith is so crucial to us, and I know it's crucial to many of our listeners. Like, just reinforcing, that the Lord loves them, but and that that Christ has so much for them in their life, and that they are accepted in Him. But sometimes just hearing that doesn't quite click though, or it doesn't quite get you when you're struggling with something so deep, like in that those neural pathways. Like, so I think it's like faith, but the Lord gives tools, like people like you, Deena, who can help dig deeper into understanding the way our brains are wired, who we are, who God's created us to be, and kind of guiding us, those people who may be struggling. If it's our daughter, if it's somebody's daughter, like they need to have someone kind of hold their hand through that to unpack and be reminded of God's love throughout the process. Because I feel like some people would be like, well, God loves you. Just like find your confidence in Him and you're going to be okay. But it's like, no, it's not that,
simple.
yeah, that's true. Very true. But it's not that simple sometimes. It's a very complex issue that is deeper than just, than just faith. I think there's like, yes, of course we need faith, but yes, we need some tools to help us through. Are you comfortable, or could you, and it's okay if you can't, are you comfortable like sharing a story about someone who's come to you and has walked through a tough season of life and has come out the other side of it with hope and living in freedom from their struggles?
In the hospital, we see patients for such a brief period of time. It's really when they're like acutely ill and needing to be refed and renourished to be medically stabilized, to then step down into like a program where they would do more like a day treatment program where they would do more of like the working through of the psychology. And then my private practice, I'm at there's kind of like this, so at the hospital, it's like the highest level of care. And then there's all these steps in between. And then my private practice is like the lowest level of care. So I don't really see people through the whole healing journey. And it's quite a long journey. It's usually recommend about 1 to 2 years of therapy. So I don't know that I could give you an example of somebody all the way through.
Maybe not like an extreme case, but maybe there's someone that came to your practice, your therapy, that was struggling with just already kind of questioning identity and finding confidence or something to.
Yeah. One patient comes to mind, a young woman who has been struggling for years with an eating disorder, with anorexia. And I started seeing her after she had discharged from the hospital, a different hospital than I work at. A lot of her identity was rooted in image. This was reinforced by her job, where she lived, and through a lot of work helping her identify her strengths and so there's a lot of that neurobiology I just talked about, and redistribute that across her life and her interests and non-body or image oriented things. We've gotten her to a place where she's applied for college and has a career path that she wants to do that has nothing to do with body image, and is actually very philanthropic and centered around helping children. And so really, like, this sense, right? So she has this neurobiology. She's sensitive. She is well attuned to others. She cares deeply. She is high achieving, very smart, very, wants to do things right. So that was all previously focused on her body image and losing weight. And through our work, we've been able to redistribute those strengths onto something totally different that really builds and expands her life and really gives her a deep sense of meaning and purpose. And so that's a pretty powerful and uplifting.
I love that. That's so amazing. And I like how you kind of point out the strengths of an individual struggling in this challenge. And if anyone's listening and you're like, whoa, like, I think I might be struggling with this, just remember, like, you have God-given strengths, you have beauties and passions that God gives you for a reason. And we're all struggling with one thing or another, and this is just a different form of struggle. And so we're cheering anyone listening. We hope that you can just find hope in this conversation and not despair. And Deena, we'll link your practice too. I don't know if you do Zoom clients, but maybe you can get a few clients from this.
Yeah, it makes me think of, when you point out people's like strengths and how, almost, that the devil kind of wants to take our strengths and kind of twist them so that they're kind of used against you to harm you. And I think about, a couple that just, like, as you were listing them out, I was like, oh yeah, procrastination. Sometimes I struggle with that, but the side of that is like efficiency, so being efficient, like, how can you, he wants to twist it and be like, procrastinate, keep pushing that project off because I know I can get it done real quick later, but how can you use that efficiency for good rather than allowing it to get pushed. I was just kind of like extrapolating that out into,
Any strength can be like twisted into something really detrimental or problematic, right? And but if we're able to kind of like reground and remember that these strengths were given to us for a purpose, and really like find faith in that and really use that as an anchor, then we can turn it around.
I can't help but want to pick your 2 cents on diet. And in your private practice, do you touch on diet with your patients? And what do you recommend? Or are you just trying to get any sort of calories in, sort of a thing?
Yeah, in the hospital, it's really just trying to get calories in and trying to figure out one's metabolic needs, because often when people are malnourished and they have to rebuild heart tissue and brain tissue and turn on all these metabolic processes that were turned off, it's extremely, and like, it takes a lot of energy. So they need a lot of nutrition to get everything going back. So it's really figuring out how many calories they need at the end of the day. I don't really do any nutrition or diet consulting, but it is interesting. This is another, overlap of my husband's world and my world, because he is very much in, the kind of animal-based diet and nutrient-dense food, right? And if you think about healing the body and giving the body the building blocks that it needs to do what it knows how to do, right? You think about, quality nutrition, animal-based diet, but it gets tricky because, if somebody has an eating disorder and they have that brain that gets so detail oriented, they might get too fixated on the details of a healthy diet and then start the cycle again. So it could be tricky. We get in debates about it. We often do.
I almost wonder though, if you just fixate them, like, here's your like planned meals, like make sure you're getting like a fistful of protein and a fistful of carbs, like, like kind of like almost harnessing that, like, you got to do a good job, so make sure you're eating, and like, I don't know, that's just where my mind went, like, just kind of making a plan for them so that they're like, oh yes, and then their brain is like, yes, I'm succeeding in my plan.
Right. That's always the goal, and I'm very inspired by those patients. Like, when we see the rule follower nature that we can then apply to recovery, that's ideal, right? Like, yes, eat this amount, this is what your body needs, this will help you heal, and they're able to run with that. That's the goal. But oftentimes people are so entrenched in like the darker side of the eating disorder that it's really difficult to wholeheartedly get on board with what would actually heal them.
Yeah, I feel like there's a lot a lot that could aid in healing and stuff. Like I think about just like, you know, things that kind of help in that journey. Probably, you know, going out to Kevin's farm and like getting in the grass, being with
Getting in
nature, and kind of
nature.
getting
Yeah.
your mind,
Yeah.
kind of off the burdens and stuff that they may be facing too. And
depending on the school of thought and who you're talking to, there is a world where there's a big conversation around eating disorders and the root conflict being one of dependency and intimacy. And so if you think about how disconnected we are from our food and each other, and how breaking bread around a table like really connects us, right? Like it is interesting to think about, people with an eating disorder going out to a ranch, seeing, being connected to nature, being connected to the food system. For some people that might be a huge part of recovery, and for others it might not. But it's a very interesting thing to think about, like how to use connection and healthy interdependency as a component of recovery, and kind of exploring like any disconnections within oneself, within the food system, within one's family system, relationships. It can be very interesting.
Yeah.
Awesome. Well, thanks so much, Deena, for jumping on. This was super interesting to me, and I don't know if there's any final call to action, like if you for a mom or dad or someone who's an advocate for a friend, like, I don't know. I don't feel like I have a step to take if my cousin was struggling with a very severe eating disorder. I mean, what do I do? I don't know.
If somebody's struggling with a very severe eating disorder, certainly go to the doctor, hospital, get checked out. But in terms of like what you can do as a friend or a family member with emotional support, I think, checking in, asking questions, not being in denial about it, early intervention, and remembering that often there's so much misinformation out there about eating disorders, that it's, all about body image, or that it's a choice, or people are doing this to themselves. And for people that really struggle, it's just so much more complicated. There's so many more layers. And, I do see patients and I do see families where there's a lot of blame on the child who's struggling. And so to remember that this is multifaceted. This isn't about any one thing. There's no like one trauma, one trigger, one person or parent who made it happen, or the person struggling themselves, right? This is like a very complicated, layered disorder that requires a lot of understanding, a lot of attention, and a lot of support to really get through. And so I think a lot of patience and just openness and seeking the appropriate medical support too, because it can get really dangerous.
Well, that's super helpful and encouraging to just be a friend, be someone that can check in and talk to, not be like pointing the finger either, about saying like, what's wrong with
it's
you?
More
it's
complex
more like,
than
way
that.
more
And I've had a
complex.
sense of that though. Like, it's more complex than I know. I'm like, I can be a friend, but I don't know if there's much more I can do in some of the situations that I've been around. But
And I think one really concrete recommendation for people, a lot of like practicing your own body neutrality, body acceptance, and not making comments. Like a lot of the times if somebody's, for example, in recovery, their body changes throughout recovery. And a lot of times people will say things like, you look so great, you look so healthy, so well-intentioned, but does not land that way, right? So if you suspect somebody is struggling, just don't even make comments about their body, right? Like don't even...
Just say like, it's so good to see you. Like I missed you if you haven't seen them in a bit, or like, it's glad to
modeling,
be with you.
like redistributing. So when you're in an eating disorder, you're so focused on your own body. So, right, as a friend or partner, we can model being interested in other aspects of that person, right? How you doing? What are you interested in? What books are you reading? What's a funny show you watched lately? Like taking the focus off their body and really helping them and lead them back into like this bigger life that we're living.
Right. Love that. That was so good. Woo.
Yeah. I'm glad we fished for that last nugget there too. Thanks so much for sharing with us, Deena. Tell Kevin hi. We We got to get out to the farm sometime and hang with y'all
know.
and enjoy some of those chocolate chip cookies. I always remember those chocolate chip cookies
I was
we had at
thinking
your
about the
place.
steak,
And
not the cookies.
Steak.
steak.
Steak and my famous chocolate chip cookies are a staple in our household. So, yes.
All right. Well, thanks
All
so
right.
much, Deena, and till next time, right?
Yes.
Thank you so much.
All right. Well, that was a very insightful conversation. Thank you, Deena. And I look forward to hanging out with Kevin again. He was teaching me how to lasso some cattle last time we were hanging out. So I'm going to get better at that. I will. But I just want to leave us with a thought that, you know, it is a tough situation to love on someone that can be struggling so deeply. So just be that friend, be that shoulder, be that community that people need. And, you know, it can be very isolating, I guess, if you're struggling with something that much. And don't be afraid also, if you are, to reach out and talk to someone, find a solution, find a way that you can, kind of retrain those neural pathways. I know it can be very hard. But yeah, I wanted to also just remind us that we do have a strong identity in Christ. If you're of faith, like, know that you're loved. Get in the Word and remind yourself daily that this is where we find our hope and truth and strength is in Him. So,
And remember, that's what this podcast is called. With God, all things are possible. And so,
yeah.
you know, that's the theme of this podcast. We want to remind people, like, what's possible. You can overcome. You can face these challenges. Sometimes we need help along the way.
Mm-hmm.
That's what God, like, puts the vocation of what Deena does in her work. Her vocation is to support people who are in severe challenge phase with this. So,
Yeah, it's so needed.
yeah.
Well, thanks for listening. Please, if you want to check out our other episodes about health, what are our other health episodes we have going on? We have like ones with Fallon. We have Kyle and Corey Malloy. They dive deeper too about ways we can support ourselves. So check out those episodes. And again, please leave us a review and like and subscribe to this channel so that y'all can keep getting updated and be reminded that, yes, all things are possible through Christ and we can overcome with Him. All right, till next time, aloha.